Okay, here we have Table 7.1, which I took directly out of your textbook. I am highlighting it here so you are reminded to always check with your payer source due to different payers having different codes that they accept. If you look at G codes, it says G codes can be reported to all payers, and I'm going to highlight that in your next slide. Your Q codes also say they can be reported to all payers. Your S codes are reported to Blue Cross Blue Shield and other private third-party payers. And it says your T codes are used to report to state Medicaid agencies and not reported to Medicare, but they can be reported to private third-party payers. Okay, so right out of your HCPCS book, your temporary codes for your G code categories. Now, notice it says many HCPCS G codes are very specific to particular Medicare policy issues and are not necessarily recognized as payable to other payers. A really good example of this is your very first code on this page, G0008, Administration of Flu Vaccine. This code is specifically used for Medicare-only patients and is not reportable to private third-party payers. You would want to see CPT code 90471 in your CPT book to use the administration of the flu virus vaccine to your other payers. Okay, your HCPCS Level 2 modifiers, which is your Appendix A. And remember, we learned that your HCPCS Level 2 modifiers can be either both alpha, 2 characters, or alphanumeric. So here's a few examples of those codes. Your BP, BR, and BU, all used if you supply a patient that has purchased a durable medical equipment from your office. Think back a few years to the Informed Consumer Act. These were all specifically written following that act so you can inform the consumer what their options are as far as purchasing equipment from your office. You also can have an alphanumeric code. If you notice E1 to E4, your eyelids, they specify upper, lower, left, or right. If your provider had done eyelid surgery on both eyes, you would need to specify right and left, or upper or lower, in order for the insurance to think that you were not pulling a duplicate bill on them. Okay. Also, if you look down at the bottom, you see where it has F1, 2, 3, 4, and 5, and it has your left-hand second digit, your left-hand fifth digit, your right-hand thumb. There are codes that you can find all of your fingers and your toes. They have their own special modifiers. Now think about when you may need to use any of these codes. So if you happen to work for a hand surgeon or for a podiatrist that's operating and possibly doing the same procedure on multiple fingers or on multiple toes, in order so your insurance company doesn't think that you're duplicate billing them because you may be using the same codes, you would want to bill each code separately with the proper modifier for the finger or toe that you happen to be working on. Okay, that concludes our little mini lecture on your HCPCS book. I hope you find it helpful, and please feel free to print these pages out so you have them for a quick reference. And once again, happy coding, but make sure that you are familiar with the different books and the different codes that you will be wanting to use.